Hi, my name is Muhammad Izham. Today I would like to present my case study. My case is about a shoulder impingement. So this is my subjective assessment. This is a Malay male, 25 years old, who are being diagnosed as a shoulder impingement syndrome. So the doctor management for this patient is conservative management, which is on medication and refer to physiotherapy only. So based on body chart, what we can see is there is a pain over right shoulder, patient having a sharp pain. Then the aggravating factor is shoulder overhead movement. Then pain scale for aggravating factor is 4 out of 10. Then each factor is by avoiding any aggravating activity. Then the pain scale is 0. So, what is patient complaint? Patient complaint of sharp pain on his right shoulder during shoulder overhead movement, VS 4 out of 10. So, for behavior of symptom, nature of pain, this patient having sharp pain over right shoulder. Then the aggravating factor is shoulder overhead movement with visual analog scale 4 out of 10. So the ease factor is avoiding any aggravating movement. Then the visual analog scale is 0. On 24-hour behavior symptom, this patient having intermittent pain. This patient only feeling of pain upon doing aggravating movement. During morning, through the day, and night, there is no pain if not doing any aggravating movement. So irritability for this patient is minimal as patient take less than 1 minute to reduce his pain from aggravating factor. So the severity for this patient is minimal only because pain scale only 4 out of 10 only. So this current history for this patient having gradual onset pain over right shoulder since 2 weeks ago. Then patient seek the doctor for further investigation. Then X-ray was taken, however no abnormality detected. And this patient being diagnosed as shoulder impingement syndrome. For past history, this patient had no history of trauma or injury over his right shoulder. And for special question, general health for this patient is good. This patient have no any medical illness and surgical history. Then the patient did X-ray. Then result is no abnormality detected. Then this patient on non-steroid anti-inflammatory drugs. And the dominant hand for this patient is right. This patient is right-handed patient. Social history, this patient worked as hospital maintenance technician. His job required him to do a lot of overhead movement, and his hobby is playing futsal and playing badminton. So this is my objective assessment based on general observation. A moderate-sized Malay man walked into the department independently with normal arm swing. So on local observation, based on an anterior view, I found this patient having asymmetrical shoulder level, which is right shoulder is lower than left shoulder, but it is a little bit only. So on lateral view, I found this patient having rounded shoulder, and on posterior view, what I found is this patient having right scapula winging, right scapula anterior tip and downward rotation position. However, there is no redness and no swelling noted over the right shoulder region. Based on this, what I can assume this maybe this patient having a tightness of pectoralis muscle, and due to scapular winging, maybe this patient having serratus anterior weakness, and also maybe having lower trapezius weakness. This is my assumption only. So based on this is my palpation, there is no warmness over right shoulder region. However, there is a muscle spasm on right upper trapezius. This is shoulder range of motion. This patient having a limited active range of motion for flexion and abduction. However, when I'm doing a passive range for this patient, I found this patient can achieve full range of motion for shoulder flexion, but with end range of pain. In a shoulder abduction, this patient also can achieve full range of motion, but this patient having pain after more than 90-degree abduction. So my interpretation for this patient having limited shoulder flexion and shoulder abduction movement due to pain. This is muscle test what I did to patient. The first one is muscle strength. I tested it based on isolated muscle. So what I found is this patient having right serratus anterior weakness and lower trapezius. This is maybe due to inactivity of these two muscles. Then another test I do is muscle control. I do it scapular assistant test. What I found when I'm doing scapular assistant test, patient pain diminish during shoulder elevation movement. So what I can conclude for this test is this patient might be having weakness and poor control of serratus anterior and lower trapezius muscles. So I also did a muscle length test to this patient because I assume this patient maybe having tightness of pectoralis minor and upper trap due to his scapula in anterior thick position. So what I found is this patient having tightness of upper trapezius and pectoralis minor. This is due to overactivity of these muscles. Then what I did is special test. This is to confirm for sure this patient having a shoulder impingement. What I did to this patient, I did two special tests, which is a near test and Hawking Kennedy test. So the result is positive for this patient. So this patient having subacromial impingement syndrome. This is what I found based on my assessment. This patient having 5 impairment. The first one is pain on right shoulder during shoulder overhead movement due to subacromial impingement. The second one is the limited right shoulder flexion and abduction due to pain. The third impairment is tightness of upper trapezius and pectoralis minor due to overactivity of these muscles. Then the fourth one is poor control of right serratus anterior and lower trapezius due to muscles imbalance. Then the last one, this patient having weakness of right serratus anterior and lower trapezius due to inactivity. This patient also having functional limitation, which is he facing a difficulty in to put and take object at higher place. Then the participation restriction, this patient unable to play badminton like the normal one because playing badminton require a lot of overhead, shoulder overhead movement. However, since this PKP, this patient not playing any sports. This is my short-term goal for this patient. My first aim is to reduce pain on right shoulder during shoulder overhead movement within 1 day. The second aim is to improve right shoulder flexion and abduction within 1 day also. Then the third one is to improve flexibility of upper trapezius and pectoralis minor within 1 day. The fourth one is to improve muscles control of right serratus anterior and lower trapezius within 1 day. Then the last one is to improve muscle strength of right serratus anterior and lower trapezius within 1 month. This is my long-term goal for this patient. I hope this patient able to perform his functional ADL such as put and take object at higher place without any limitation. Then I hope also this patient also able to participate in sport such as playing badminton without any limitation also. So my plan of treatment for this patient consists of manual therapy, stretching exercise, strengthening exercise, patient education, and home exercise program. Due to this patient having a spasm right upper trap and tightness of pectoralis minor, I do myofascial release for this patient. So after I do MFR for this patient, I evaluate back the patient. So patient claim comfortable, then spasm and tightness of upper trap and pec minor reduced. Then after I'm doing MFR, another way to improve flexibility of this muscle, this upper trap and pec minor muscle is I teach this patient upper trapezius stretching exercise and pectoralis minor stretching exercise. So after stretching exercise, I evaluate back the patient. Patient claim feel lighter and easy to move. Then I did back the muscle length test. What I found, they reduce in tightness of upper trap and pectoralis minor muscle. And the third intervention, I give strengthening exercise. Due to this patient having a poor lower trapezius and serratus anterior control, I teach two exercise, which is lower trapezius activation exercise, which is I teach low row exercise in order to activate the lower trapezius muscle. Then I teach a serratus anterior activation exercise, which is a scaption exercise. So what I found is patient able to perform correctly. Then there is a little bit improvement in a scapular movement during shoulder elevation. Then is patient claim less pain during shoulder elevation. This is maybe the patient slightly able to control the lower trapezius and serratus anterior. Then the last one, I give a patient education and home exercise program. I'm advise this patient to do all exercise 3 times per day. Then before doing any strengthening exercise, I advise this patient to do self-release over upper traps and pec minor muscle by using tennis ball. So, what I will review on next visit, I will review this patient's shoulder range of motion again, muscle strength, muscle length, and muscle control. So, this is my plan of treatment on next visit for this patient. Maybe I need to do integrated scapular control exercise in functional movement. Because this patient working as a technician, he require a lot of shoulder overhead movement. So I need to do integrated scapular control exercise in functional movement. Then what I can conclude from my case study is shoulder impingement syndrome is caused by muscle imbalance, which is tightness of pectoralis minor and weakness of lower trapezius and serratus anterior muscle. It causes limited scapular outward rotation and posterior tilt of the scapula, thereby reducing the subacromial space, hence leads to shoulder impingement. So, by improving muscle control of serratus anterior, lower trapezius muscle found to be effective measure to manage shoulder impingement case. So, this is my list of reference, which is this is one the evidence base that I use in order to treat this patient. This one is an example of a scapula.
Okay, this is a scapula assistant exercise. Scapula assistant exercise is used in during a motor assessment for shoulder impingement. So one hand over the clavicle, then another hand over the inferior angle of the scapula. So the patient need to raise up his hand, then we assist it. He put down back, and some more. Okay, if patient symptom reduce during this test, that means patient having poor scapular stabilizer muscle, which is lower trapezius and serratus anterior weakness. Okay.
Assistant test for this patient. This is a exercise which I teach for lower trapezius activation.
Patient having lower trapezius weakness, so I would like to teach this patient lower trapezius activation exercise. So to do this, trapeze hand over the inferior angle, then ask patient to do scapular posterior tip movement. Okay, then hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Some more. This exercise also called as low row exercise. This is exercise to activate the lower trapezius muscles. Okay.
This is a low row exercise.
Patient having low.
Then this is the serratus anterior activation exercise, which is a scaption exercise in a.
Based on scapular assistant test, this patient also having serratus anterior weakness. So I would like to do a scaption exercise. Scaption exercise found to be effective in strengthening the serratus anterior. So patient in crook lying position, hand on the thigh, then thumb face up. So what patient needs to do is, patient needs to put a shoulder down. Okay, squeeze the shoulder down, then do the scaption movement. Okay, up, while maintaining the shoulder down. Okay, up. Okay, some more. Press your shoulder down first. Okay, lift up. You need to control the shoulder without compensating this movement also. Okay, some more. This is quite tough for the patient. Okay, some more. Squeeze down. Squeeze down. This also. Squeeze down, then lift up. Squeeze down first, then lift up. Up. Okay, this is what we call a scaption exercise for serratus anterior weakness. Okay, thank you.
Supine lying.
Based on scapular assistant test, this patient also having serratus anterior weakness. So I would like to do a scaption exercise. Scaption exercise found to be effective in strengthening the serratus anterior. So patient in crook lying position, hand on the thigh, then thumb face up. So what patient needs to do is, patient needs to put a shoulder down. Okay, squeeze the shoulder down, then do the scaption movement. Okay, up, while maintaining the shoulder down. Okay, up. Okay, some more. Press your shoulder down first. Okay, lift up. You need to control the shoulder without compensating this movement also. Okay, some more. This is quite tough for the patient. Okay, some more. Squeeze down. Squeeze down. This also. Squeeze down, then lift up. Squeeze down first, then lift up. Up. Okay, this is what we call a scaption exercise for serratus anterior weakness.
Okay, that's all from me. Thank you.
Lower trapezius weakness. So I would like to teach this patient lower trapezius activation exercise. So to do this, trap his hand over the inferior angle, then ask patient to do scapular posterior tip movement. Okay, then hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Some more. This exercise also called as low row exercise. This is exercise to activate the lower trapezius muscles. Okay. Okay, this is a scapular assistant exercise. Scapular assistant exercise is used in during a motor assessment for shoulder impingement. So one hand over the clavicle, then another hand over the inferior angle of the scapula. So the patient need to raise up his hand, then we assist it. Okay, put down back, and some more. Okay, if patient symptom reduced during this test, that means patient having poor scapular stabilizer muscle, which is lower trapezius and serratus anterior weakness. Okay.